Bismillahirrahmanirrahim. So today I'm going to talk about a very important topic, that is the Montoux test or the tuberculein scan test, also called the TST test or the TPD test. Now there are a lot of confusions and questions regarding this test. So we must be clear regarding the basic concept behind this test. So it is a screening test. We should reserve it for the screening test. It is not a diagnostic test for TB. It does not tell you about the active infection versus the latent infection. What does it tell? It tells you that there is exposure or not. It tells about only exposure, whether the person is exposed to infection or not, whether the person is exposed to this bacteria or not. If it is positive, it means there is exposure. The person is exposed to Mycobacterium tuberculosis. So if it is positive, you should rule out the active TB. Coming toward in a few seconds toward that. But if it is positive, it means there is exposure. In order to rule out the active infection, you have to work, and we will follow the algorithm. Now there are two things. One is the false positive and the false negative. False positive mean you are having no exposure, but still the test is positive, and this is seen in BCG vaccination in non-tuberculous Mycobacterium and non-tuberculous Mycobacterium. So there are two false positivity with the Montoux test. BCG vaccination, especially if it is done within last 10 years, and non-tuberculous Mycobacterium. Which test we do in order to prevent this cross-reactivity with BCG vaccination? Answer is xray test. Interferon xray test, interferon gamma release assay. xray test, interferon gamma release assay test. False negative with what? If the person is severely immunocompromised. Severely immunocompromised, because it is type 4 hypersensitivity reaction and it is T cell mediated. So, and also we check the end duration. If you give it is it's intradermally, you check the end duration after 48 to 72 hours. So you check the end duration, not the redness. But the problem is not that of interpretation. The problem is this: once positive, it will always be positive. So no need to do it again and again. If it is positive, it will be positive for lifelong, because the person is exposed and there is priming. So if you are doing again and again, there comes a new phenomena that is called the booster phenomena. So it will be positive lifelong. If it is negative and you are repeating the test in your life later on, and if it is positive, now it means two things: either there is a booster phenomena or there is convergent phenomena. Booster phenomena mean you give the first shot, they presume the body that the body consider it as to be exposure. Now when you are repeating the dose, there was the T cell activation with the first dose. With the second dose, what happened? There is exaggerated response. So if you are repeating the dosage will increase response. So with the first dose it was negative, with the second dose it is positive. It is positive. So either the booster phenomena or the convergent phenomena. The booster phenomena mean that is because of the dosage the response was increased, and this is not exposure. Convergent phenomena mean there is new infection. There is new infection. New infection by over here I mean new exposure, not the active infection. There is exposure. Now how would you differentiate between the convergent and the booster? Well, the end duration must be equal to or more than 10 mm. The end duration must be equal to or more than 10 mm and equal to or more than 6 mm from the last reading. In the last test, if it was 4 mm, so it must be 10 mm now. If it is less than 10, If it is less than oral 10 or less than the whole, so conversion mean new infection. So it must be equal to or more than 10 mm, and it must be equal to or more than 6 mm. So there is criteria for that. It must be equal to or more than 10 mm, and it must be equal to or more than 6 mm from the last reading. So let's suppose last reading was having 3 mm, and now he's having 6 mm. So 6 plus 3, 9. So it must be equal to or more than 9 in order to label it as a conversion. So these two criteria must be met in order to differentiate between the booster and the conversion. So there is a lot of confusion regarding this test. So we have to clear all those confusions. So coming toward the interpretation. So what you do, you inject Montoux reagent in the skin of the forearm, and you look after 48 to 72 hours, because it is a delayed type of reaction. And you look, what you do, you measure the end duration. Let's suppose this is the forearm. You measure the end duration, not the redness. You measure that hardness, and you measure that hardness perpendicular to the long axis of the arm. Let's suppose I am having end duration over here. So what I do, this is the long axis of my forearm, this is the long axis of my forearm, and the lesion is lying over here. So I have to measure perpendicular to the long axis of the arm. So I have to measure, this is the long axis of the forearm, I have to measure in a transverse direction perpendicular to the long axis of the forearm. So it is type 4 hypersensitivity reaction, it is a T cell mediated reaction, and it is delayed type of cell reaction, delayed type of hypersensitivity reaction. So if it is less than 5 mm in duration, 5 or more than 5 mm, 10 or more than 10 mm, 15 or more than 15 mm, these are considered positive in this patient. Let's suppose the patient is having HIV and he is having close contact with the TB patient. Even in this patient, if the end duration is less than 5 mm, it is positive. It is considered, the test is considered as positive. And how to proceed in a positive test, we are coming in a while. Now in this group of patient, you need this much end duration, 5 or more than 5 mm, to label these as positive. Now in this patient, in this group of patients, if your end duration is less than 5 mm, this is negative. So in this you must have this much end duration. So immunocompromised patient, those patients who are receiving chemotherapy, those patients who are on steroids, how much steroids? 15 or more than 15 milligram of prednisolone for equal to or more than 1 month. This is considered as immunocompromised condition with steroids. HIV, but not with the close contact with the TB patient. If close contact with the TB patient, the cutoff is 5 mm. If no contact, cutoff is more than 5 mm, equal to or more than 5 mm. Close contact of any patient with a TB positive patient. Abnormal chest radiograph. Now the chest radiographs that are abnormal, 10 or more than 10 mm. Chronic diseases like CKD, CLD, cancer, homeless people, IV drug abuser, jails and healthcare worker comes under the this definition. 15 or more than 15 mm. If a patient is having no risk factor, he must have 15 or more than 15 mm in order to label him positive. So coming toward if the test is positive, if the Montoux test is positive, the definition of positivity I covered in the previous slides. So what is the next step? You do chest x-ray and you do sputum studies. Chest x-ray and sputum studies. If both of them or one is positive, x-ray finding consistent with the active TB, or the sputum studies showing the active TB. If both are negative, coming toward first negative, if both are negative, the Montoux test is positive and the chest x-ray and sputum studies are negative, what you do? Active disease is ruled out. This is latent TB. So what is the definition of latent TB? Only the Montoux test is positive X-ray and sputum studies are negative. This is latent TB. This is latent TB. And there is no risk of transmission from one person to another person. But there is risk of conversion to active TB. There is the risk of conversion to active TB. So we treat these patients. And if both or one of them is positive, what we do? Treat it as an active TB. Treat it as an active TB and screen all contacts. And screen all contacts. So this was a short video regarding the interpretation. When will we label it as positive? If it is negative and repeat test is positive, what does it means? Booster or conversion? And if it is positive, what will you do? Thanks for watching.